Brooks Running has a new shoe for you runners out there. Did you hear that? Better turn up your volume. In fact, turn it up to the max. Introducing the all-new Ghost Max. It's got all kinds of things to make your knees and ankles feel protected, like Max Cushion, Max Soft Landings with DNA Loft V2 foam, and Max Smooth Rides with their Glide Roll Rocker. Feel better on your run with Ghost Max. Learn more at brooksrunning.com.
If you have a chronic condition or a parasitic infection, there's a medication that can help. Even preventative measures, like vaccines, have saved thousands from diseases that were once a sure death sentence. But this pharmaceutical approach is no longer used only for serious illness. Whether you're tired, have a headache, or need to lose weight, there's a pill for that. But have we become too reliant on the pharmaceutical industry to fix all of our problems?
To me, it makes sense why we came to this deep love affair of conventional medicine. And we don't want to throw the baby out with the bathwater. That's why I do integrative medicine, because I love much of what we have to offer in conventional medicine. It's often too heavy-handed for many of the common problems that people are living with, which are better addressed through diet, lifestyle, exercise, stress management.
That's Dr. Teroni Lodog, a globally recognized expert in integrative medicine. This approach combines conventional medicine with more holistic therapies like acupuncture, meditation, and herbal remedies. She says a key component that's missing from modern medicine is the relationship between doctors and patients. The standard 15-minute visit can't paint an accurate picture of a person's lifestyle and habits. At a minimum, Lodog says this time needs to be doubled for each patient.
Even 20 minutes feels like a luxury, but 30 minutes for many of these more complex patients, it gives us time to be able to talk about diet, ask them how they're sleeping, how they're managing their stress, what are their personal health goals, what is important to you right now. And that is hard to do in a 15-minute visit. And in that 15-minute visit, when you don't have time to ask a lot of these other things, it becomes very easy to pull out the prescription pad and write a prescription. It's not just doctors, is what I'm trying to say. Most doctors are just trying to do the very best they can, but it's a system itself, which is designed for acute care management and is really ill-equipped in its current model to deal with more of the chronic problems people are living with.
Part of the integrative medicine approach is treating diseases that occur because of lifestyle factors by making lifestyle changes. Of course, certain medication can be helpful, but they shouldn't be our first line of defense. For example, people with type 2 diabetes often have metformin as the first medication prescribed to them. Dr. David Katz is a specialist in preventative medicine and public health with an expertise in nutrition. He believes a huge problem with the health of Americans is the lack of balance between exercise and diet.
The prevailing lifestyle in the United States is deficient in physical activity and excessive in food. But if we look at the food side, we basically have C's of excess. So excess calories, excess saturated fat, excess sodium, excess added sugar, excess refined carbohydrate, and a vast excess of junk where food ought to be.
Many of the processed foods we eat leave us without the key nutrients our bodies need to function, like fiber, potassium, and antioxidants. And while dietary supplements are a great resource, Katz says we should first look to change the foods we eat before adding another pill into our lives.
We could focus on lots of different nutrients that would benefit health, or we could just focus on the foods. And I recommend the latter, because if you get the foods right, the nutrients sort themselves out. And if you focus on any number of nutrients but don't get the foods right, you're still going to be missing out on something really important.
That doesn't mean that dietary supplements are completely off the table. In fact, Katz says that this kind of all-or-nothing thinking can be harmful to our overall health. The key is using supplements on an as-needed basis. Focus on eating nutrient-dense foods, then add in the ones that are harder to get from your diet, like vitamin D. The amount of vitamin D you need will change based on where you live and the time of year. Katz takes more in the winter, but may not take any if he's vacationing at the beach. And though almost everyone could benefit from more vitamin D, your gender and age can determine which vitamins you may need to add into your diet. For example, women have much different health risks than men.
We're more prone to depression than men. We're far more prone to autoimmune disease. We're more prone to osteoporosis, right? We're more prone to hypothyroidism. There's many, many things that women experience that maybe we're less aware of that are different than what men experience. So when it comes to supplementation, some of the big ones here are ensuring that during our time that we begin menstruating until either, we cease menstruation naturally or we have a hysterectomy, is that we're ensuring that we're getting adequate iron.
Having an iron deficiency can cause extreme fatigue, shortness of breath, and can interfere with your body's ability to regulate temperature. Low Dog says women are most at risk of this during menstruation and pregnancy.
A basic multivitamin with iron is a very wise thing for women to do. If you are at a place in your life that you could be pregnant, making sure that that multivitamin contains adequate amounts of folate or folic acid is also really important because you need that on board before you're pregnant.
When you're thinking about which nutrients to add into your diet, it's important to understand which vitamins and minerals work well together and which don't. Calcium, for example, needs to be taken with vitamin D.
You need vitamin D to absorb the calcium in your diet. And we know many, many people, men and women, are low in vitamin D. But because women are more likely to develop osteoporosis, ensuring that you're getting enough vitamin D so that you can absorb the calcium and get that into your bones is important. So many women I see today, their dietary calcium intake is maybe 450, 500 milligrams instead of 1,000. And it's because we don't drink all the dairy that we used to, or maybe eat all the cheese that we used to. We like almond milks and other milks that may or may not have that amount of calcium in them.
So taking a supplement can help maintain bone strength. But once vitamin D helps your body absorb the calcium, how does it know where to go? Low Dog says that's where vitamin K2 comes in.
Vitamin K2 acts almost like a traffic cop, if you will, directing the calcium in your blood to go into the bone instead of laying down inside of your blood vessels or your kidneys. So if you're taking a multivitamin, try to look for one that has vitamin K2 in it, or take a calcium, vitamin D, and K2 supplement separately so it's all together.
However, you need to be careful when mixing calcium and multivitamins that have a lot of iron, because the extra calcium will block the iron from being absorbed.
That's why you'll often see calcium supplements taken separately from your multi, because it's a big, you're talking hundreds of milligrams of calcium and you're talking 18 milligrams of iron, very small. And a lot of these micronutrients compete for transportation outside of your intestines. And so you don't want your calcium to be taken at the same time as your iron. Also, just like it can interfere with the absorption of some other vitamins, it can also interfere with the absorption of a number of medications, prescription medications. So it's best to take your calcium 2 to 3 hours apart from taking your other medications. So if you take most of your medications in the morning, you can take your calcium in the evening so that there's plenty of space between them.
One nutrient that you may be surprised to hear most Americans don't need to supplement is protein. Kat says it's really only a concern for older men.
So for the most part, we eat too much protein. Almost no Americans are protein deficient, and it's not doing us any favors. It's almost unheard of in the US outside of burn units and the intensive care unit. But the healthy range of protein intake does shift over the life cycle. And men who are trying to hang on to lean body mass, and that is important, and retain muscle, which is important for functional ability, may want to be more attentive to their protein intake, quality and quantity as they age.
Katz is experiencing this firsthand. As he's gotten older, he's noticed that his muscles aren't responding to exercise like they used to.
And these are hormonal effects and age-related effects, and we can combat them to some extent, but we can't not age. And there is an argument then that a slightly higher intake of protein and a good distribution of essential amino acids is especially helpful to men after they hit 50. And from personal experience, I would say even more so after you hit about 60.
But for everyone else, Katz says society's current fixation on protein is misplaced. Instead, he thinks both men and women should be focused on getting enough fiber.
Almost all Americans are massively deficient in fiber. And that's extremely important. There are two kinds of fibers, soluble and insoluble. The insoluble fiber is crucial for the health of the gastrointestinal tract. And one of the disturbing trends we're seeing in the US today is colon cancer at ever younger age. So gastrointestinal disorders are rampant, whether it's inflammatory bowel disease or irritable bowel syndrome or colon cancer and other cancers of the gastrointestinal tract. But part of that is we don't get nearly enough fiber, which feeds the microbiome, keeps things moving through the GI tract.
On the other hand, soluble fiber plays a completely different role, but it's just as important. It dissolves in water, specifically in your GI tract, and creates a physical barrier. This barrier slows down the process of nutrients being absorbed into the bloodstream, which reduces certain responses like insulin production.
So if your diet's high in soluble fiber, you need much less insulin to maintain a healthy blood sugar level than if your diet's low in soluble fiber. And type 2 diabetes and insulin resistance and metabolic syndrome, all conditions related to needing lots of insulin and not being able to produce enough, these are all epidemic. In fact, they're pandemic. These are massive problems all around the world. And there's a remedy available to all of us in the food supply, and that's a higher intake of soluble fiber.
This is just one example of how integrative medicine looks at the full picture to treat chronic issues instead of using medication to spot treat the symptoms. You can find more information about Dr. Teroni Lodog, Dr. David Katz, and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. Our executive producer is Amira Zafari. I'm Elizabeth Westfield. Coming up next week on Radio Health Journal.
So what may work for you perfectly for 1 year, 3 years, 13 years, you could wake up the next day and it feels like it has no effect on your body at all.
How to deal with an invisible illness.
Then what to do when nature destroys our habitat.
We have animals committing manslaughter, home invasion, breaking and entering, trespassing, jaywalking, vandalism. You know, they're just animals being animals.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
You can even filter down to the level of the kinds of bags that you'd like, so grocery bags or bread bags. And all of that is representative of the food that happens to be surplus in the marketplace that you live in.
Discounted mystery bags of food? Sign me up. Then
it's everything from not being able to read a newspaper article to not being able to understand a job instruction manual or a credit card agreement or a lease agreement.
Why we're failing students when it comes to reading in America. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
McDonald's presents Burger Reviews by Hamburglar. Today's review, the best ever Big Mac burger. Take it away, Hamburglar.
Rubble, rubble.
He said, there's more special sauce in every bite.
Rubble, rubble.
He said, rubble, rubble.
Rubble, rubble.
Rubble, rubble indeed, my friend.
Try the juicier Big Mac and get 20% off any purchase of $10 or more. Only on the app. Comparison to prior classic burgers. Limited time only at participating McDonald's. Valid once per day. Excludes tax. Must be opted into rewards.
Ba-da-ba-ba-ba.